Hello, I'm Bruce Maloch, your state senator for District 12. For the past couple of weeks, I've been posting daily updates about the coronavirus or COVID-19 on my Bruce Maloch for Senate Facebook page. I thought it was time now to just take a few minutes to discuss some of the issues that are facing all of us as Arkansans. First of all, and the most important issue is your safety and health. So I want to talk about kind of where we are and some things that we need to do. As of today, the United States has over 250,000 cases of the coronavirus. In Arkansas, our first case was discovered on March the 11th, and as of April the 2nd, we have 643 cases, and that continues to rise. Now, our Department of Health has done some modeling and projections of where we think we will be and the number of cases that we think we will have as we move forward. And that totals about 3,500 cases, or at least the projections, in the next couple of weeks. Now, the good news is that the current cases that we have now are actually below those projections, so hopefully we won't go that high. But the reality is that it's a serious issue. We know that we're going to have more cases, and we need to take all of the possible precautions that we have. By now, you're probably tired of hearing all the warnings that come from the CDC of how we're to handle ourselves. Wash our hands frequently. Stay away from big groups. Isolate, or at least keep a 6-foot distance from anyone else. And then finally, if you're showing any symptoms of the coronavirus at all, such as a fever, a cough, aches, shortness of breath, you need to contact your medical provider. And when I say contact your medical provider, that doesn't mean immediately go to the doctor's office. Contact your doctor's office or your medical provider's office and tell them your symptoms and talk through it with them. One of the things that the state has done during this crisis is to expand the ability for our medical providers to use telemedicine. And most of the insurance companies are also reimbursing doctors with their phone calls or telemedicine or video conferencing that they're having with you. And so that's the first step that you need to take to help determine whether you need to be tested. Now, the state has taken a number of actions already to help slow the spread of this disease. The first thing that the governor did was to close the schools, and of course that has been extended. And then we closed inside dining to restaurants. They closed casinos, dentist offices, hair salons, barbershops, limited the size of gatherings to 10. And actually, today, over 80% of the United States population is under some sort of a stay-at-home or a shelter-in-place type order. Now, there's been some discussion, and I've had a lot of constituents that have contacted me wanting our governor to issue a shelter-in-place or a stay-at-home order. The governor actually addressed that at his news conference on April the 2nd, and he pointed out that a lot of the states that have these orders, they have exceptions for essential services. They have exceptions for jobs that are essential services, which is really a pretty high percentage of the jobs that are out there. And there's not a lot of difference between what our state is requiring and what some of those states have ordered if our people will comply. So I certainly encourage you to follow those guidelines, stay away from the big groups, keep your distance when you do have to go out, wash your hands, all of those type things that I mentioned, so that hopefully we can bend that curve, that we can slow the spread of this disease and get past this crisis that we're in. Now, in addition to your health, which again is the most important, I want to also talk to you about some of the economic issues that surround this crisis. Of course, we know at the federal level, the Congress has met. They've passed different relief packages that the president has signed that will give some benefit to our citizens, to the states, and some loan programs. I have also linked to some of these articles and some of these programs on my Facebook page. If you'll scroll back and look at some of that. I really don't have time to get into a lot of detail about those programs here, but feel free to contact me and I'll be glad to go over those or to find the information for you if you need them. Let me talk a little bit more about the state's economic situation. On March 23rd, the governor issued a revised revenue forecast and said that our state would be down about $350 million from what our initial expectations were. Now, our fiscal year ends June 30th. And so rather than having 12 months to make up that $350 million shortfall, we've got to find that in the next 3 months of this fiscal year. So it's really going to require some belt tightening, and there's some things that we've done. Now, of the $350 million, about half of that is due to the decreased sales tax revenue and the decreased income tax withholdings. People, some have lost their jobs. We don't have as much income tax revenue. We're not out there spending as much money, so we don't have as much sales tax revenue, and that's a part of the shortfall. The rest of the shortfall is the fact that we have moved our state income tax filing deadline from April the 15th to July 15th, just as the federal government has done, and that's delayed some payments from this fiscal year into the next fiscal year. But at any rate, we've got a shortfall, and that's the reason that the governor called the legislature back into a special session last week. The state, up until this point, had accumulated a $173 million surplus, and those were unobligated funds and required legislative approval to be spent. And so the governor called the legislature in to authorize the use of those surplus funds to fill some of the holes that are created because of this budget shortfall. That legislation also set up a panel of senators and representatives to oversee the use of those funds as recommended by the governor. There's 3 senators and 3 House members on that panel. I'm pleased to be one of the 3 senators that will be monitoring that money. With my background when I was in the House, I served as chairman of the House Joint Budget Committee and have always been involved on the Joint Budget Committee. And so I'm pleased to be able to be involved with that and to put those funds where they're needed most, again, to help fight this coronavirus crisis that we've got and to help our citizens. Now, I guess we've already had one disbursement from that fund. It was $45 million, and it was used to purchase personal protective equipment for, again, our first-line providers, whether it's doctors, nurses, EMS professionals, that we had shortages not only in Arkansas but across the country. And we've purchased equipment, first of all, to protect them as they protect us. So my message to you tonight is, first of all, be safe. Take care of yourself, follow the guidelines of the CDC and the Arkansas Department of Health, and help your neighbor. Check on them. Give them a telephone call, particularly if you've got elderly neighbors that maybe cannot get out. Maybe you can stop by the grocery store if you're going to make a run, even if you have to just leave it on their front porch and settle up later. But reach out and watch out for each other. And also, I want you to know that I'm here to help. I want to help you as you help each other to provide information. I'll continue to provide updates on my Facebook page, Bruce Maloch for Senate. You can go there, like that page, and follow it. Also, if you want to contact me personally, you can do it by Facebook Messenger, or you can go to my webpage, which is Maloch for Senate, Maloch the number 4 Senate.com, and there's an email link there, and I certainly want to help you in any way that I possibly can. We'll continue to do these updates from time to time. I'll continue to post updates on my Facebook page as we work through this together. And again, be safe and have a good day.